Hello, my name is Justin Clancy, and today I will be presenting on behalf of Morgan Carter and Kevin Davis. This presentation will entail our Tippecanoe County Health Department Accreditation Plan. Tippecanoe County is located in the west central portion of Indiana and home of our very own Purdue University. It has a population of roughly 196,000 with a demographic of 82% white, 6% black, 8% Asian, and 8% Hispanic. Precisely 91% of this population has a high school diploma, with 39% of that population earning at least a bachelor's degree. The median income is about $53,000 per year. The mission statement of the Tippecanoe County Health Department is to enhance the health and welfare of Tippecanoe County through public health education, promotion, prevention, and the protection of public and environmental health. The Tippecanoe County Health Department is divided into 5 divisions. The first, birth and death certificates, assesses the current birth and death rate of the entire county. The second, nursing and immunizations, focuses on communicable and infectious disease control involving the Gateway to Hope syringe exchange program. Third is the environmental division. This division revolves around the safety of the surrounding environment of the community residents. This division analyzes testing and treatment of the water for contaminations, septic tank inspections, housing issues, and body modification regulation. The fourth division, foods and public pools, is responsible for improving quality of life for Tippecanoe County citizens by inspecting food of retail restaurants and retail establishments, as well as being responsible for inspecting the public pools within the county. Last but not least is the Emergency Preparedness Division, involving response time, resources and assets, utilities management, and safety and security. As of the most recent reportings, the current county's health improvement goals include participating in community efforts to improving mental health, decreasing the spread of disease from substance abuse, promoting access to exercise opportunities and healthy eating, decreasing tobacco use, increasing public health outreach and awareness programs, and providing resource guides to residents. The current accreditation process from the past 4 years began in January 2017. The TCHD planned an initial community health needs assessment as well as a revision of the Community Health Improvement Plan. Later that year, the IU School of Public Health administered a survey determining pertinent health issues. In October 2018, the county established a Community Health Improvement Planning Committee, which implemented a new and improved plan released in 2019. This was followed by the hiring of a new administrator, Kala Huffstedler. Lastly, their most recent update was from March 2020, in which COVID-19 pandemic hit, putting all accreditation proceedings on hold. The most recent health improvement plan acknowledged several areas of focus, one of which was substance abuse. Concerning statistics reported 1 in 3 high school seniors had used alcohol in the last 30 days. There was also reported 9 cases of possession and 202 cases of spice use, also known as synthetic marijuana. Other drugs reported included 11.2% of college students trying prescription drugs not prescribed to them, which resulted in 22 prescription drug-related deaths in 2015. In that same year, it was also noted 65 cases of heroin use accounted for 8% of all accidental overdoses. Another area of concern was chronic disease management. This area mainly pertained to hypertension, high cholesterol, anxiety, depression, and an assortment of chronic diseases related to various smoking statistics, which indicated a higher rate with lower income residents. Relating to the lower income respondents, another relevant area of focus is affordable housing. 85% of respondents noted homelessness as the greatest community need on the survey conducted in 2016. 22% of respondents reported an income of $40,000 or less, indicating a need for affordable housing. Additionally, Purdue itself noted student housing was potentially leading to overcrowding, impacting the overall housing crisis of the county. The final area of focus the TCHD acknowledged was mental health care. As of 2016, the ratio of mental health providers per capita was 748 to 1. Approximately 85% of respondents indicated mental health care and child abuse prevention were the highest need in the county. As a means of competing with the demanding forces of health and extreme levels of change throughout the years, a balanced scorecard can be used as a management tool to assess and meet these challenges. The first of four components is the customer perspective. TCHD aims to increase the awareness of community health issues as well as establishing high-quality care with knowledgeable professionals. These will hopefully translate to equal opportunities across the county with equal access to health resources. The internal business component is based on internal evaluations. This includes service analysis, healthcare clinic evaluations, and a reflection of the efficiency and effectiveness of the proposed incentives. The third component, the innovation and learning perspective, involves collaborations amongst healthcare groups and partnerships with researchers and other health agencies. Once accounted for, the following three components are driven and controlled by the financial perspective, which is responsible for budget allocation across the county and a cost-benefit analysis of healthcare changes made throughout the process. To stay on track of the health improvement plan leading to potential accreditation status, an intervention strategy is used to set target goals with individual strategies. Overall, the TCHD noted 4 goals to focus on during their designated time period noted in their most recent health improvement plan. The first 2 goals were aimed at decreasing substance abuse and improving mental health in the community. Their strategies included increasing awareness to at-risk populations, involving programs such as the Gateway to Hope, and increasing health providers for leadership and support. The third goal focused on decreasing chronic diseases and increasing physical activity. This goal reflected the chronic disease management area of focus and proposed solutions promoting healthy eating, physical activity, and an initiative to decrease smoking among the youth population. Lastly, the fourth goal was designed to promote a stronger presence in the community. This included initiating a social media presence promoting community services and events, and connecting Purdue University to host health fairs and offer health-related testing to students. Going forward, we believe continuing to increase community involvement will result in overall higher awareness and a better understanding of the relevant health concerns. This will hopefully bring awareness of access to resources, which will motivate public health officials to configure equitable distribution to healthcare services, healthy food options, and resources that promote physical activity. Lastly, we would recommend to incorporate a system management strategy. Through research, health concerns can be evaluated and investigated to the point where deemed, if needed, policies can be implemented to better the community and increase healthy lifestyles. While TCHD will one day continue to strive for an accreditation status, as previously mentioned, their process and aspirations have currently come to a halt due to COVID-19. This has come with many implications as it progressed to a global-wide concern involving serious consequences. As the number of cases and deaths have increased significantly since it first began, the priorities of health departments across the country were forced to shift. From TCHD's perspective, aside from the obvious priorities of stopping the spread and decreasing the total cases, in relation to the areas of focus previously mentioned, substance abuse and mental health need to be prioritized. Suffering individuals across the country have all admitted at one point in time they've experienced infection fears, boredom, frustration, and financial loss, which were all determining factors in their current health behaviors. To combat the rising mental health and substance abuse concern, TCHD will have to resort to creative solutions. For instance, if public health leaders have a little bit more flexibility and make minor changes, it can open up opportunities for people to get out of the house and at least alter the perception of a once normal reality. Making minor adjustments such as increasing restaurant hours, creating innovative solutions to comply with social distancing, and strategizing ways for restaurants to increase capacity while maintaining safety precautions can go a long way. Additionally, encouraging fun and safe outdoor activities gives people the option of getting out of the house and at least potentially boosting morale. At the end of the day, health departments need to be aware of the impact in their counties and need to prioritize the repercussions of the pandemic. For TCHD, that means putting off their accreditation aspirations and continuing to service the affected individuals, as health and safety of the population is and forever will be the number one concern. Thank you for your time. Please see the following references used throughout this presentation.